Okay, good morning, ladies and gentlemen. Welcome to the United States Senate debate in Washington, D.C., June 27, 2021. Here I am, Azahra, the president for today's debate. I believe that all senators have made an adequate preparation for this meeting. Before we begin, we will first conduct a minute of silence. We may pray according to our belief. Minute of silence begin. Minute of silence end. Right, the debate is attended by 9 senators from several states. There are Senator from New York, Senator from California, Senator from Virginia, Senator from Florida, Senator from Texas, Senator from Pennsylvania, Senator from Nevada, Senator from Michigan, and Senator from Arizona. And the topic for today is about healthcare in the USA. Healthcare in the United States is provided by many distinct organizations made up of insurance companies, healthcare providers, hospital system, and independent providers. Healthcare facilities are largely owned and operated by private sector business. Community hospital in the USA that non-profit and government owned. Healthcare coverage is provided through a combination of private health insurance and public health coverage. So we move to the first session. Under the purpose order, the leadership time is reserved. Under the purpose order, the Senate will be in period of morning business with senator permit to speak therein for up to 5 minutes each.
Madam President, ask permission to speak for 5 minutes in this session.
Without objection, the senator from Michigan, you may have the floor.
Madam President, Americans have long longed for the world's best healthcare facilities in the US for the better. Americans should also be the first to experience the best healthcare facilities. So in that way, we and all of Americans want to dispel that longing by bringing a better healthcare system into our very backyard. It is so frustrating, yet so unfortunate to me, that we haven't had a deal made over the discussion of a better healthcare system, whereas we are the entrusted one. We have worked so hard to create a better system of our health, and my folks on the other side also have known about that. What I would like to propose is that let's make the new healthcare system come into reality, and I'm calling my colleagues on either side. We are desperately thankful to our previous POTUS, Mr. Trump, that was very supportive to repeal Obamacare, that burdening our great country to achieve more for the goodness of our future. Let me clear up what was my point. I'm going to tell you that the single payer system will not be working for the long term, and moreover, that particular PD system also hardens the American as well. It was the tax revenue in which come from our fellow American pocket, whether they are wealthy or not wealthy. It is honestly what shocked me the most. That I know many great people, and most of them are my colleagues, and they are supporting this regretful system. So I hope that folks over here could make a consensus to pass the bill over the repealing of Obamacare. Nevertheless, I understand why some Americans are supporting this system. It is because they thought the democracy tells us that the rights of every person should be guaranteed. And in this regard is the right to get access to a good healthcare. But I suspect that this is not the kind of democracy that many people belong themselves as a big fan of. It is the compulsion towards our not so fortunate brother and sister to help others getting paid for their own health treatment. We do care about citizens' health welfare, but not at the expense of others' economic welfare. So maybe not all of us over here have agreed with me so far that Obamacare is not the right call. Since the previous president, President Donald Trump, we made many accomplishments in our effort to reform the healthcare system in the USA that USA has had. The skyrocketing taxes have been reduced, and the stagnancies of medical innovation have been lowered as well, thanks to the retraction of Obamacare. This is also mean that we are providing affordable generic drugs to the market faster, and that was our first accomplishment. Second accomplishment is we were limiting tobacco products to our youngsters to protect our future generation from the big potential threat. That was our second big win over Obamacare. Thus, given the accomplishment we have achieved, we have contributed to at least 5 points. The first one was lowering the cost of drugs. Second, increasing health innovation. Third, saving taxpayers' dollars. Fourth, protecting children and families. And the last one, helping seniors. So once again, pass the bill. These are the results that demonstrate that there is something better than Obamacare. We also felt so unfortunate that many Americans were succeeded in their effort to condemn any further effort to give a better healthcare system to all Americans, saying that Obamacare was the democracy fulfilled. But I can assure you that this is not the right thing. And because of our presence here is the debate, so I think it is the right time for our friend on the other side to tell us what they have in mind. And we will see how the American people feel about the ideas. And the only thing that I'm concerned about is that are we not going to make anything that we all hope want to achieve? I hope that all American not going to regret that we could not find a better way forward. Thank you. I yield the floor.
Madam President,
The senator from Pennsylvania.
okay. Democrats have simple idea that everyone should have some basic security in healthcare. And we believe that healthcare is a right, not a privilege. And our healthcare system should put people before profit. Thanks for the Affordable Care Act or ACA over the past years that former President Obama and fellow Democrats has built. More than 20 million Americans have gained health care coverage, and, and the uninsured rate has been cut almost in half. With that program, we will keep costs down by making premiums more affordable, establishing an independent review board to assess the value of launch product and recommend a price for Medicare based on external reference pricing, reducing out-of-pocket expenses, and capping prescription drug costs. We most likely act on a set of changes meant to expand the ACA to make health coverage less expensive for those who buy their own plans, and the ACA has also allowed states to expand Medicaid to help even more Americans get covered. One priority is raising the income ceiling for those who receive subsidies, expanding the number of people who qualify for help, and another is rewriting formulas to take the size of the subsidy to a more generous health insurance plan, a way to increase the amount of assistance. The ACA's premium subsidies or premium tax credits were designed to keep health insurance affordable for people who buy their own coverage in the individual market, even though the individual market is a very small segment of the population. However, the rate increases have been much more muted across the full population. We have proposed various strategies for making coverage and care affordable, including to give the government authority to block rate increases that are deemed unjustified. And we also support the government and we also support the ACA's provision that all health insurance plans must cover contraceptive with no cost sharing and instrumental in making emergency contraception available over the counter. Pennsylvania also put the law promise subsidies to insurers to make sure their participation and premium subsidies to individuals to avoid or delay a death spiral. We also want to end pay for delay or practice that keep low cost generic drugs out of the market, repealing the law barring Medicare from negotiating drug prices with pharma manufacturers and also Americans to buy prescription drugs from other countries, which is like in 2019, the Democratic led House passed legislation that would make it easier for generic drugs to enter the market. Although they also added in various provisions to shore up the ACA. That is why we want to preserve the ACA or expand on it by moving towards universal coverage, possibly with a single payer approach. And an expansion of the ACA also would mean more insured patients. That would likely translate to greater patient volumes and less uncompensated care on the other hand, but the addition of a public option would mean lower reimbursement for many providers on the other, given that Medicare rates are generally considerably lower than those of commercial insurers. Thank you. I yield the floor.
Madam President,
The Senator from Texas.
a high uninsured rate to Medicaid population and a lack of service has given Texas some of the highest rates for disease and death, especially in this pandemic. In Texas, has passed a grim milestone with over 11,000 deaths from COVID-19 in the state. And for Texans who have recovered from COVID-19, they have allowing Supreme Court to worry about which strengthens protection for pre-existing condition. The overall declines in concern was evident in both attitudes and reported behaviors in most measures. Republicans as a group convey lower level of concerns about vulnerability to COVID-19 and its effect, and report following public health guidelines for slowing the spread of the pandemic at lower rates than the Democrats and political independents have many points. When asked to consider two thread between fighting the pandemic and helping the economy, a majority of Texans, 50% think it's more important to try to control spread of the coronavirus even if it hurts the economy. 38% said it was more important to have economy even if it hurts efforts to control the spread of the virus. Texans approval governments handling the pandemic decreased for levels of government, federal, state, and local, though Texans still give the most positive ratings to local governments. As they did in state governments saw the largest decrease, the net approval in part due to a 15-point increase in those who expressed disapproval. Fewer Texans People were concerned about both the spread of the coronavirus in their communities and about contractor or a family member contracting the virus in the latest fall than they were in the pandemic. The share of Texans who reported being extremely or very concerned about the spread of the coronavirus in their community decreased from the 50% in April to 47 in June. The share of Texans who report that they were only leaving their residence when they absolutely had to show a dramatic decrease from 63% in April to 37 in June. Those who report living normally, coming and going as usual. I yield the floor.
Madam President.
Senator from California.
Okay. The National Institutes of Health is a research facility of the United States Department of Health and Human Services. The institution is the principal agency of the United States government responsible for biomedical and health-related research. In this case, California is a state located on the west coast of the United States with the large population in the United States. For example, in Southern California, which has a high weather throughout the week, so health issues are very important to use. California has a Department of Public Health, which is the state department responsible for public health in California. The agency also enforces several California health and safety laws, particularly the license of certain types of healthcare facility. Under its function is two important statewide operate record. CDPH operate the medical marijuana program, which is the text with issue identity card under the 1996 and the California Senate Bill for 120. There is also a Center for Infection Disease to protect people in California from the threat of preventable infection diseases and size to living with infection disease in securing fast and appropriate access to health care and treatment. Then there are several public health efforts carried out by California, such as one support the investigation and diagnosis of infection disease that are important to public health, to identity, prevent and stop the transmission of vaccine preventable AIDS, new infection disease such the current COVID-19 pandemic. On teasing human research and budget from government and non-government source, we have also worked with health officials in Mexico to protect and promote the health of the people living in California border communities. And then supporting the public health and medical needs of refugees undergoing resettlement in California. One of the achievements that America has achieved, namely the Affordable Care Act in 2010, is the result of healthy policy reform carried out by Democratic Party, which aims to create a universal-based health service. Therefore, in our opinion, as part of the Democratic Party, we want to continue the exciting programs, and we also want a role for the state in accommodating all health serving nationally and being able to ensure that the entire United States society is no exception to the poor, both American or minority. Thank you. I yield the floor.
Madam President,
The senator from Arizona.
Okay, thank you. Regarding this healthcare case, I will give a brief overview of how I felt the healthcare case in the United States. I will take the example of Obamacare case, which became a health program during the Obama administration. During its reign, the program has not received very positive responses. It was first published, but after the change of power from Obama to Trump, which also meant the change of power from Democrats to Republicans, responses to the Obamacare program for the first time received more positive responses than those who viewed it negatively since the program was inaugurated in 2010, which when Trump began his term as president, he marked the beginning of Republican effort to reform policies on the Obamacare program. The Obamacare policy contains a prohibition targeted to insurance companies to refuse to provide health protection to people who already have certain health conditions such as diabetes, pregnancy, and even cancer. The policy also allows young people to remain their parents' health protection plan until they reach age of 26. Based on that turning response before, we can say that these Americans do not know what they are getting with Obamacare. Maybe even until there is a discourse to revoke the policy on Obamacare. So that after sacrificing so much expenditure on health to make a distance of almost a third of health expenditure in the percentage of GDP from France, Sweden, Germany, and the Netherlands, but the impact from this novel program is not yet so clear, and there is no clear significant difference that can be felt by Americans as a whole. Obamacare has threatened the United States budget, and in addition, one of the main problems is the high premium that must be paid by the middle class, making the return from this program far below the initial projection. This is a big stumbling block for the realization of this Obamacare program because the cross subsidy process, which is the key to the success of this program, hasn't been achieved. And the lack of restraint has also resulted in insurance companies slowly dropping their intention and even resigning from participating in the Obamacare program. So we need to revise this Obamacare policy to not only focus on its noble goals without considering the consequences in other sectors that actually can also have significant impact on other sectors, just in terms of the economy and the state budget, which will certainly affect the other sectors. We also need to make strict and balanced rules that are not so detrimental to the middle class community so that this whole program can be carried out better and more effectively, even approaching the achievement of the objectives of this program. And because of that, what we need to do to overcome this problem in Obamacare, which is a health subsidy program that should be able to improve the health of the citizen, but in reality, it's actually just nudges the other sector, which is in the end, it will also affect the health of the citizen in various ways. So now we better act immediately and unite to change this health program to be more effective so that more lives of people out there can be saved and get the right treatment immediately. That's it. Thank you. I yield the floor.
Madam President,
The senator from Nevada.
okay. Madam President, I come to the floor to speak in support of proceeding healthcare, and that is critical to our country. The provision of healthcare is not mentioned in our Constitution or the Bill of Rights. Our founding fathers are fully focused on life, liberty, and justice. Likewise, the Supreme Court has never interpreted the Constitution as granting the right to healthcare service from the government for those who cannot afford it. However, recently, the Supreme Court has argued that the government has an obligation to provide medical care in certain limited circumstances, such as for detainees. Regardless, health should be something that people get easily. Health is part of humanity. When sick, anyone has the right to get cheap and fast medical help. The government in this case is the party most responsible for ensuring the health of its citizens. Health becomes very expensive item when you live in the United States. On average, Americans spend almost 4 times as much on pharmaceutical drugs. The cost will increase many times over if you have to stay in the hospital if you injure. Expensive health service do not make us quickly treated by health workers. To get treatment, you must make appointment in advance. The high cost of healthcare affects everyone. It has suppressed the purchasing power of individuals over the last decades. American salaries have increased, but NEPA has remained the same as the cost of health insurance has also increased. Now, our spending is urgently needed to help stretch medical and hospital resources to control COVID-19. The right to health is part of a fundamental right that must be obtained by every citizen. although it is relatively new to be recognized as part of the rights that must be fulfilled in state standard or a common standard of achievement for all people and all nations. Its existence is recognized by the international community as a recent deterrent for human dignity. The human right to health demands the role of the state to be fully involved in effort to protect and fulfill it. People who are not healthy will potentially be unable to obtain their other rights, such as not being able to obtain and undergo decent jobs, not being able to enjoy their rights to association and assembly, to express opinion, and potentially not getting the right to education their future. The outbreak of the COVID-19 pandemic, which increasingly requires us to always side by side by the community. We must start by making COVID-19 testing widely available to and free to everyone. We must support making COVID-19 testing, treatment, and any eventual vaccine free to everyone, regardless of wealth, insurance coverage, or immigration status. Accessible, affordable, and high-quality healthcare is part of an American promise that Americans should have the security that comes with good healthcare. Democrats believe that not Americans should face financial poverty because they get sick or they get hurt. We also believe that all Americans have a right to healthcare, that making healthcare available and more available to Americans will help health the economy. We believe as Democrats that healthcare is a right, not a privilege, and our healthcare system no should put people before profits. Every American should have access to quality healthcare, and no one should go bankrupt just because they get sick. And we'll never stop fighting to protect that principle. Thank you, Madam President. I yield the floor.
Madam President,
The Senator from Virginia.
uh, I think a country as big as the United States should have 100% national health insurance for its citizens. This is to protect its citizens from non-traditional security threats, such as pandemics currently happening. With GDP reaching 21 trillion US dollar, the government has budgeted 16.9% of GDP for health. Such a large budget should be more focused on the National Health Insurance Program that is systematically integrated by the government so that the community can get health services with good standards evenly. The existence of a national health insurance makes the cost incurred to obtain health service cheaper. In addition, it also creates cross-subsidies between people who are young and healthy and people who need health services. While integrated health services are very useful in efforts to deal with a pandemic like the one currently happening, as we know, the case of the COVID-19 pandemic in the US have reached 33.6 million and resulted in 630,000 deaths. This number may be reduced if the US has a national health insurance and integrated health system so that patient care is more effective and efficient. Patients who are old and have congenital diseases certainly need more care than patients who are young and do not have congenital diseases. More treatment certainly requires more expensive costs.
I yield the floor.
Madam President,
Senator from Florida.
thank you for the opportunity, Madam President. I'm sorry for I made some problems. The burden of having access to healthcare is made all the more clear by the impact of coronavirus outbreak is already having on our communities and our economy. It is impossible to have a thriving and stable country, state, or community if people are sick, are scared for their health, or their health of their family and friends. When we talk about healthcare, we talk about the COVID-19. The healthcare and safety of our patients continue to be our top of priority. As we continue to monitor COVID-19, we want to reassure our patients that all of our locations will remain open across our three-country area of both Hardy and Highlands. And for that reason, we have Florida Healthcare Plans. Florida Healthcare Plans is dedicated to providing our members with a wide range of Florida health insurance plans to allow for greater coverage flexibility. We offer an array of HMO, POS, and triple option group health plans, as well as extensive individual coverage and insurance for Medicare eligible beneficiaries. We strive to our members low copays, affordable pharmaceuticals, and high-quality care they can trust. But again, when we talk about the pandemic, we are not talking about the patient, but also the medical workers, right? In this pandemic, many medical workers will lose their jobs. The main reason is because here we are. We are Democrats. We are here in Delhi fighting for worker rights, fighting for health insurance for everyone, and we stop paying health insurance for our employees. And now in Florida healthcare insurance policy that had been cancelled more than 2 months ago under the previous party leadership has been reinstated. And the employees insurance claims made over by two past months will now be covered. I'm furious because so many of these staffers didn't even know they had lose their job until it was posted. And so we have folk we are going to the doctor, seeking access to the medication in the pharmacy, thinking that everything was fine, not realizing that employment, the Democratic Party of Florida was not paying their healthcare average. Democrats have been fighting to secure universal healthcare for American people generation, and we are proud to be party that makes Medicare, Medicaid, and the Affordable Care Act. Thank you for the opportunity, Madam President.
Madam President,
The Senator from New York.
New York healthcare is in crisis. Hospitals are closing units and some are even shutting their doors. Hospital administrators are forcing nurses to take on too many patients at once. In some hospitals, it's getting to be a common sight to see patients waiting on gurneys for hours and hours, sometimes days and days. All of these problems have one root cause. There is people running our healthcare system want to run hospitals as a business. New Yorkers also struggle to afford high healthcare costs. Support a range of government solutions across party lines nationally. Consumers worry about healthcare affordability is well documented, but now, for the first time, a new survey revealed how affordability concern and ideas for action play out in New York. A survey more than 980 New York adults conclude from 20 December 2018 to, to, to January 2019 found that more than half, 52% experience healthcare affordability burdens in the past year. Even more, 76% are worried about affording healthcare in the future and across party line. They express strong support from government-led solution. Like many Americans, New York's currently experience hardship due to high healthcare costs. All told, 52% of New York adults experience one or more of the following healthcare affordability burdens in the period 12 months. Being uninsured due to high premium cost, 51% of uninsured adults cited too expensive as the major reason for, for not having coverage, for exceeding other reason like don't need it and don't know how to get it. Nearly half, 45 of all New York adults who need healthcare during the year, one or more cost-related barrier to getting that care. 31% delaying going to the door or having the procedure done. 29% skip a recommended medical test and treatment. 22% avoided going to the door, or having a procedure done altogether. 23% cut pills in half or skip doses of medicine. Moreover, cost was for, for the most fair frequency cited reason for not getting medical care, exceeding a host of other barriers like transportation difficulty, getting an appointment, like all lack of children and other reasons. Of the various type of medical bills, the ones most frequently associated with an affordability barrier include doctor visit, dental prescription, likely reflecting the frequency with which New York adults seek this service, or in the case of dental, lower rates of coverage for this service. I yield the floor. Thank you.
Madam President, I ask anonymous consent that when the Senate completes its business today, it adjourn until 2 p.m. Monday, June the 28th, that following prayer and pledge, the morning hour be deemed expired. The journal of proceedings be approved to date, the time for the two leaders be reserved for their use. Later in the day and morning businesses be closed. Further, upon the conclusion of morning businesses, the Senate proceed to executive session to resume consideration of the boardman nomination. Further, that if cloture is invoked on the boardman nomination, all post-cloture time expire at 4:35 p.m. Finally, that if the nomination is confirmed, the motions to reconsider be made and laid upon the table with no intervening action or debate without objection. Madam President, if there is no further business to come before the Senate, I ask that it stand adjourned under the previous order.
The Senate completes its business today. It adjourned until Monday, June 28, 2021, that following the prayer in the morning hour. Thank you for all the senators to give the statement about this healthcare issue. Thank you all for making my presence when comfortable as possible. Without objection, the Senate stands adjourned until 2 p.m. tomorrow. Thank you.